Hi, I'm Dr. Farber.
Hi, I'm Dr. Shaw.
Let's talk briefly about GLP-1 agonists. They're commonly known as Mounjaro or Ozempic. These are the most common weight loss drugs that are out now, and a lot of people are taking them. They are effective with helping you lose weight, but there are some risks associated with them, especially with plastic surgery.
So before surgery, you should be at your ideal weight. So usually a lot of people, unless you're using it for diabetes control or other like medical indications like that, most people are off of them before they undergo plastic surgery, especially for cosmetic procedures. And if you are on them, we would like you to be off of those medications about 2 weeks prior to surgery. And this is to decrease the risks related to delayed gastric emptying and aspiration with anesthesia.
Another thing is that it's basically like controlled starvation in the sense that a lot of patients, if not managed correctly by their prescribing provider, whether it's their primary care doctor or family practitioner or whoever it may be, they need to be managed appropriately with getting frequent labs in order to manage the nutritional status. So how does that play a role with surgery? Well, if you are malnourished with deficiencies in vitamin levels, deficiencies in protein levels, then you will have a very difficult time healing after surgery, and it significantly increases your risks of complications after surgery, specifically those of infection and healing. You may end up having wounds that require a long time and a lot of care to heal. So prior to plastic surgery, or any surgery for that matter, you want to make sure that your nutrition levels are optimized, specifically higher protein levels, and make sure that you're taking multivitamins as well to make sure that you're not vitamin deficient at all.
Now this class of medications, it's a game changer for a lot of people, and we've seen amazing results. But we've also seen a lot of complications due to the medication not being used appropriately. There's some people that will just prescribe this medication without the proper follow-up and monitoring that is required for safe weight loss. And it's I've seen a lot of really good things happen. However, there is, just like every good thing, if it's not used properly, it can be bad.
It's not without its risks, and just want to make you aware of that. And during your consultation with us and preoperative appointments, we'll make sure that you're optimized for your surgery.
Yes.